Hello, I'm Dr. Andy Loetscher, an oral maxillofacial surgeon, and I'm putting this video together to mostly educate you as a parent for when you bring a child in for surgery and an anesthetic. Most of the children that come in for surgery, we put your child to sleep under general anesthetic. We have a lot of children that come here from children's dental offices. They send us patients, so we treat a lot of kids. Most parents come in with a certain amount of fear and apprehension as far as the process, and that's very normal as a parent. We're going to put your child to sleep. You're concerned about their safety. One of the important issues as a parent you should understand, your fears and apprehension are going to be mirrored in your child. And so when we treat children, we're all pretty much aware, all of us practitioners, that a nervous parent, a troubled parent, provides a troubled, nervous child. If you come in as a relaxed parent, you're fine with what we're doing. Your child is relaxed, and it's a much better experience for everybody involved. And so I kind of want to go through some of that with you. To begin with, when you bring your child here, we're going to put your child all the way to sleep, but they will never see a needle. We pretty much put a mask on their nose and put them to sleep. When they come back in the room, they can bring their teddy bear, their stuffed animals, a blanket. So when you come in that day with your child, you're always wondering, can I come in the room with them? Yes, you can come in the room. And so you'll come back to the room. If it's your first time with us, we'll spend a few minutes talking to you and your child, determine what we do. If you come in for a consult ahead of time, we've already gone through a lot of that with you. But what we do to put our patients to sleep, the children, we put a little mask on their nose, and when that goes on, they start breathing gas, and that puts them to sleep in 2 or 3 minutes. 4 or 5 people in the room, everybody has a specific job. We're watching your child. You can stay with them for the first few minutes. But once we go to put your child to sleep, we cannot put your child to sleep with you in the room. And that process of putting them to sleep starts when their mask goes on. And once they're asleep, we start the IV, we put a breathing tube in them, and they're asleep breathing the gas. And it goes very, very smoothly. A couple things about the anesthesia, okay? One thing that we do differently than most places, we actually put your child all the way to sleep with a breathing tube, the same way it's done in the hospital. It's called being intubated, and it's actually the safest way to go. There's the breathing oxygen through that tube, and the anesthetic gas is kind of a luxurious way to go to sleep because they're not getting any sedatives, they're not getting ketamine, Versed, narcotics. It's just that gas that keeps them asleep. And when we shut it off, they wake up and they're pretty alert in 5 or 6 minutes. The gases leave your body in minutes. Usually once they're awake, they walk to the recovery room, and that's when you can first join them. I do have to warn you, a lot of children, especially like 8 or 10 or younger, often cry when they wake up for the first few minutes just because they're a little bit disoriented, but they're safe. The other thing here is we have 3 RNs that are very skilled with children. As far as coming here, there's a few things I think that we do that are very advantageous for you. We treat a lot of children. As I said, we make the environment nice. If you're preparing your child, a few do's and don'ts, you don't want to talk to your child about needles because they're never going to see a needle. You don't want to say, I don't know if you're going to get a shot or a needle. Don't even bring it up because they won't see the needle. They're going to, once they're asleep, we'll put an IV in them and we'll give them Novocaine. So you don't even need to bring it up with them unless they ask you. You can say, what you want to reply is, nope, you're never going to see it. It's you're going to be asleep. They may ask you, is it going to hurt? It's really not going to be painful for them. They're going to be asleep. And once they're asleep, we're going to numb them up with Novocaine. So they wake up, it won't be painful. So in general, it's probably given me one of the nicer dental appointments I have. And most procedures take 20-30 minutes on children, so it'll seem like a split second for them. Not too long ago, I brought my daughter in for anesthesia. I had to put her to sleep, take out some teeth. I still remember driving her here to the office. She was just sitting there like relaxed, and I brought her in. And my daughter came back, and she sat in the chair. We put her to sleep, and she woke up, and she went home, and I went home that Friday afternoon, and she's out there riding her skateboard. And I asked her later, I go, you nervous? She goes, no, why would I be nervous? And I thought that's actually really nice. And it's like, and probably because it was her dad treating her, but still, I mean, that's the way it can be and should be for your children. One of the options you will have when you schedule is, do you want to come in for a consult ahead of time? And it's we do that both ways. Some parents want to come in and meet me ahead of time, which is fine. Some are fine coming in that same day. And there are some times it's probably good to come in for a consult. Like if your child has had a terrible dental experience or any kind of procedure that was terrible, it's probably good for them to come meet us. We can tell them you're not going to see any needles. You as a parent can meet us and see our facility, meet our staff, hopefully be reassured. If they have any health problems or anesthetic issues in the past or some metabolic problems with their body, I would want to hear about that ahead of time, and you might want to bring them in. And if they're really nervous, just some children are just extremely nervous no matter what you tell them or how you prepare them. We can have them come in a little bit early. We'll give them some oral Versed to take ahead of time, and that'll like 30-40 minutes, and that'll relax them. And if it's a teenager, sometime we can prescribe them some Valium, take the night before or that morning to help as well. A lot of patients then come in just the day of surgery, and one option is that, for example, if your child fell and broke a tooth or has an injury or has an abscessed tooth, you can't come in ahead of time for a consult. You can always call and speak to a nurse, and we can go through some of these questions with you, and you can relay some of your child's health history with us too, and that is also helpful.